We all know about the death panels. Can you tell us some other aspects of the healthcare reform bill, ones that maybe are a little more real?
Well, the healthcare reform bill, I think, is a very major benefit for us in New Mexico. What it does is it expands the the Medicaid eligibility, so that anyone with income up to 133% of poverty will be eligible for Medicaid, and that's a lot of people in our state. About another 120,000 people in New Mexico who are not currently on Medicaid will be eligible for Medicaid beginning in 2014. In addition, it sets up what we call insurance exchanges, and people will be able to obtain insurance. People who have incomes above 133% will be able to obtain insurance through these insurance exchanges, and the government will subsidize the purchase of that insurance, depending upon the level of their income, up to about 400% of poverty. So it's a way for us to get, there's 26% of New Mexico citizens who don't currently have any coverage. It's a way to get coverage to that group. And we think it will also result in reduction in cost growth in healthcare, and also improvements in quality. So that's the idea behind it. It's a pretty large piece of legislation. It's going to take several years for it to be implemented. They've started implementing it now, and some provisions have gone into effect already. There's a provision that says anyone who has a policy and wants their child or their young adult to remain on that policy up to age 26 can do so, and keep that person on there. Now they can charge a little more, the company can, but they've got to keep them on the policy if they choose to stay on the policy.
And I'm certainly grateful. I have a 17-year-old daughter.
Well, that will be handy. And there are also provisions in there for ensuring that people up to age 18 cannot be denied coverage because of pre-existing conditions. So that's an important improvement. There's a provision that says there can be no more rescission of contracts or insurance policies unless the company can show that there was fraud committed.
Can you explain rescission for people
who
don't know?
Well, rescission is essentially where if a person gets sick or comes down with cancer or some major ailment, the practice in the past has been that some companies will start looking around and try to figure out some reason why they can just go ahead and drop coverage. And there have been a lot of instances where they've done that. It has not been illegal in the past, and now it will be. There's improvement as well. And there are some others that preventive care, particularly for people on Medicare, checkups, immunizations, those types of things, flu shots, all of that will be done without any copay for people on Medicare in the future.
Well, that's very nice.
Yeah.